Steps to mitigate the spread of virus. So within the common areas, you want to practice a routine cleaning of all the frequently touched surfaces, including the doorknobs, light switches, the elevators, windows, common areas, furniture, tables, etc., all electronics. So that's where everybody's going to be hanging out and touching.
What's up YouTube, Jeff Wybo here, and in this video we're going to be talking all about the coronavirus. But first, let me get a little bit more comfortable.
That's better. So in this video, guys, I'm gonna teach you guys how to be a landlord with this crazy coronavirus that's going on right now. So make sure you guys stick around in this video. It's gonna be a lot of great tips for you guys. I'd really appreciate it though if you would actually just hit the like button right now. That'd be awesome. And if you want some real estate advice, make sure you guys follow this channel. Really appreciate it, guys. So just wanted to get into the multi-residential best practices for planning to respond to the COVID-19. Most of this video will be for large multifamily or commercial investors, and hopefully this video doesn't scare you guys off with, these are real world problems that are coming up right now being a landlord. So with saying that, I'd like to make some recommendations that you can take or leave as a landlord right now. So if there's a presumed case of COVID-19 in your buildings, you're gonna wanna call your insurance provider immediately and follow their directions. You're also gonna wanna be following the directions of the health authorities in your area. You as a landlord, you have a legal duty of care to your tenants, so it's important that notices are posted at the front of the buildings, in the common areas of the buildings, generally just to advise your tenants on the situation that's going on. Now, Health Canada and the World Health Organization have made a number of recommendations to help you out, the public, in preventing and addressing the spread of COVID-19. Many of these recommendations are applicable to multi-residential or commercial properties, so myself has to follow these rules, especially if you're faced with a report that a tenant, employee, or visitor of the property has been diagnosed with a suspected case of COVID-19. Now, guidance has been given by the public health organizations on how to provide notice of suspected cases of COVID-19. So notice to residents and employees and visitors: if an employee or resident is confirmed to have COVID-19, employers should inform fellow employers and residents of their possible exposure of COVID-19, but maintain a confidentiality as required by Personal Information Protection and Electronic Documents Act, or PDAC. Should also instruct all residents and employees to self-isolate and contact their primary health provider if they have a fever, respiratory symptoms, or believe they are sick. Self-isolating individuals should avoid having visitors to their home, avoid any contact with immune-compromised individuals and older people. They should remain in their residence until instructed otherwise by their healthcare provider. Also, instruct residents and staff that, in general, the following can help reduce the risk of infection or spreading infection to others. Number 1, wash your hands often for at least 20 seconds with very, very, very hot water. Avoid touching your eyes, nose, and mouth with unwashed hands. When coughing or sneezing, cover your mouth and nose with your arm or a tissue to reduce the spread of germs. Immediately dispose of these tissues in the garbage as soon as possible and wash your hands again. Refer residents to their local health unit, Health Canada, and the World Health Organization websites for up-to-date protocols. I know if you search about coronavirus on Instagram or on Twitter right now, it actually brings you, if you're Canadian, right to the Canadian government website giving you the up-to-date information. The next thing you should be doing is help counter any stigmas that are going to be going on within your buildings all about the COVID-19. That is so important, guys. Write that part down. Steps to mitigate the spread of virus. So within the common areas, you want to practice a routine cleaning of all the frequently touched surfaces, including the doorknobs, light switches, the elevators, windows, common areas, furniture, tables, etc., all electronics. So that's where everybody's going to be hanging out and touching. If surfaces are dirty, they should be cleaned using detergent and soap prior to any disinfectant. If you are using a disinfectant, be sure that it is effective against the COVID-19 virus. Just follow the manufacturer's instructions for all cleaning and disinfectant products. This will ensure that the products are effective and the staff are safe when using. If there are common areas in the bathrooms or visitor bathrooms, ensure that they are adequately supplied with soap, water, and any drying materials. Provide alcohol-based sanitizer with at least 60%, 60, alcohol for the use of common areas. Consider placing sanitizer near the entrances and the exits of the buildings, in common areas, and near stairs and elevators. Consider providing disposable wipes, if you can even get them at the store, so that residents can wipe down commonly used surfaces after use. Display notices detailing proper hand washing. Consider whether access to common areas should be restricted. You can also consider whether the current risk of infection warrants the restrictive use of the community rooms, the fitness rooms. Decisions to restrict the access to these rooms should be made on a case-by-case basis, considering the risk of the spread of the infection. Advise residents using the laundry rooms to wash laundry thoroughly and clean the laundry room frequently. Clothes and bedding should be immediately removed from machines once the washing and drying process is complete. Encourage residents to wash and dry their clothing using the warmest temperatures recommended on the fabric label. Okay, for your staff, emphasize that staying at home when sick is actually a really good thing right now. If they're experiencing any symptoms of a fever or anything like that, they need to stay home. They do not need to be validated by a doctor. If they are telling you they're sick right now, let them stay at home right now. You do not need a sick note from their doctor whatsoever. Okay, well, we still have to operate our landlord business right now, so you want to come up with a continuity plan that's going to carry on past this outbreak right now. So the plan needs to address your business and how it will continue to function in the event that a large number of employees are unable to work due to the illness. This will be slightly different from a normal plan that you have going on in your building when there's problems and they can't attend, because obviously this is a really important event that's going on in the world right now. So identify and train backups for essential or all functions if possible. Consider how you will continue to provide services if your service providers are unable to continue their work. Ask yourself this question: can employees perform these services on an as-need basis? Do you have a backup service providers? You need to research your business commitments. You may have to determine what the legal ramifications will be for non-performance or poor performance, and really ensure everyone knows who is next in line for management. So the chain of command is extremely important to know what the decision making is, because people are going to have illnesses, you're going to have gaps in your employment. This is very important that your employees know the role of the person ahead of them. One thing you probably never had to think about, but you're going to have to start thinking about now, is how are you going to address the media if one of your buildings has an outbreak? So start coming up with a media plan as well. When developing your plan, seek input from your employees or other individuals within your organization. Incorporate reference to preventative measures your business has taken to prevent outbreak. Now, with all that being said, guys, this is an unprecedented time, so I do encourage you guys to be super safe out there. Follow all these steps and your business as a landlord can continue to strive. I really appreciate you guys watching this video. Again, it's probably not going to get monetized because YouTube doesn't monetize any COVID-19 content right now, but really appreciate it if you guys would hit the like button, hit the subscribe button. We will be back on the channel with a lot more, more fun real estate tips coming out to you guys, not just this COVID-19. We will get through this together, us, the community, the world, because that's what we do. We always strive on. We always say, even on this channel, problems are profits. So let's take these steps and let's move on and let's be successful landlords in the future. Thank you guys so much for watching. Bye.
What's up, guys? Jeff Wybo here, and in this video we're going to be talking all about the coronavirus.
No, wait, I can't.
Are you done?
Nope.
Can I take this off yet?
Nope.
This smells like gas in here, actually.
Just one moment.
That's better.